Welcome to the Neuromodulation Podcast, presented to you by the International Neuromodulation Society. Dive into the forefront of today's emerging neuromodulation techniques, insights, and ethical and clinical applications. Subscribe now to join the multidisciplinary collaboration of medical care providers, scientists, and engineers who are part of the global conversation that's shaping the future of healthcare. Welcome to this episode of the Neuromodulation Podcast. Part 2 of this 3-part series offers a powerful and honest account of a patient's journey through Parkinson's disease and their decision to undergo deep brain stimulation. This episode offers a rare glimpse into the experiences of Larry Gifford, a neuromodulation patient who underwent deep brain stimulation for his symptoms with Parkinson's disease. Join us to discover the challenges faced, the outcomes achieved, and the emotional and physical impacts of neuromodulation from a patient's perspective, providing invaluable insights for those considering this therapy, with loved ones navigating the neuromodulation journey, and for clinicians working with potential and current neuromodulation patients. So with that, Larry, great to have you on the show today.
It's good to be here.
Wonderful. I'm wondering if we could start off by having you describe your experience with being diagnosed with Parkinson's disease.
Sure. Yeah. Well, yeah. Sort of have to go back to the year 2000 when I started getting like these weird symptoms. Like I had a walkie walk, and like one day for one night, my right hand just shook and like a tremor. And then I started having these weird pains, and I didn't think anything of it. And then 17 years later, as I collected these symptoms and these bizarre occurrences, seemingly disparate symptoms, the tremor came on full force on my right hand. And so my son goes, "You should see a doctor." And he was like 7 at the time. I was like, "Yeah, you're probably right." So I did. And they're like, "Whoa, okay, you should see a neurologist." And when I went to the neurologist, he's like, "You probably have, we probably have Parkinson's." I'm like, "Probably? Can we firm that up with a test or something?" He goes, "Well, there's one test I can give you." I said, "Okay." He goes, "It's an autopsy." And I'm like, "Oh, well, I'll wait on that, doc. Thanks." He goes, "We just don't have any other tests at this point because there was no biomarkers at that time." And there's no blood test. We don't know what causes it. We don't know how to cure it. And we don't know how to tell you if you have it for certain or if this is an adjacent disease.
Wow.
Like, okay, well, that's comforting. No?
Oh.
That was the experience of diagnosis. And it was hard. I mean, when you hear those words and you realize like life is changing forever. Like this isn't just a cough or a cold or a broken bone, or you can't take Parkinson's out of your body. Like if you have a bum heart or you get a new heart, like there's none of that. This is forever. And that is hard to come to terms with.
So you've just learned that you have Parkinson's disease, or you think you do at this point?
Well, so it was 2017. That was the official diagnosis, was the
Got it.
kind of the, well, you probably have it.
Okay, so, well, you probably have it. That's your official diagnosis. What's the next step? What was recommended to you?
The only thing that was recommended to me at the time was to exercise as much as I could. I said, which exercise? I go, "We don't know. Whatever one you'll do is the best one." I'm like, oh my God, like there was just no roadmap at the time. And I don't know if you can tell this by looking at me, but for our listeners, exercise and I were frenemies most of my life. And so that really, I was kind of hoping they'd say, just eat a lot of chocolate, it'll be okay. But that didn't happen. I went home and I tried to find the answers in the bottom of liquor for about 8 months, and it was not there. And then one day I was as a guy who's been in radio for 30 years, I was listening to podcasts. I was trying to find a good podcast from a patient perspective. And I heard a doctor on one of the podcasts, I think it was the Michael J. Fox Foundation podcast, and he said, "If people with Parkinson's don't start sharing their stories, we'll never bring enough attention to raise enough money to do enough research for anything to be done about Parkinson's disease." And I thought, oh, well, I'm a storyteller. And if I'm not willing to share my story, how can anybody else share theirs? Why would I expect them to? And so we started a podcast at that point called, my wife and I called "When Life Gives You Parkinson's."
And what's your wife's name?
Rebecca.
Rebecca. Lovely. Tell me a little bit about the experience of creating this podcast. And in particular, I'm curious, you go through the entire journey from really learning about Parkinson's and how to navigate that in your own body, to going in and getting treatment, and then the post-care. And along the way, your wife was with you for the journey. So I'm curious if you can share, what was that process like?
Well, it was a lot of, do we really have to record this, honey? I'm like, yes, if we're going to do the podcast, we're going to do it right. So we recorded as much as we possibly could. And then we would download after things and sort of sit in the family room and just talk it out on tape. And there were some things where she's like, we're not taping this. We're not taping this. I'm like, well, that means we should tape it, honey. But for a while, that's what kept me going. That's what allowed me the permission I gave myself to exercise was, well, it's going to be on tape. It's going to be part of the podcast. I need to do it to show people what they should be doing. Or I'm going to go to a support group. And so they're going to give me permission to record it. So it'll be good for the podcast. And so by giving myself the podcast to sort of as the excuse to do the things that I should be doing and the things that they recommend that you do in order to, support yourself and to be better in the long haul. I mean, exercise actually is the only thing they can prescribe to keep the symptoms from advancing faster than anything else. And then for me, it was like I was trying like all sorts of crazy exercise that people do because where they like throw tires and stuff, and I forget what they call it, but like I was doing everything, boxing, and so preparing for that, and it was all for the podcast, but it was also for me. It allowed me to do it. It gave me, I was no longer the guy who wasn't fit or the guy who wasn't an exercise guy. Now I'm the podcast guy doing this stuff. Does that make sense? It was almost a role to play.
Yeah, it creates also a really lovely sense of external accountability that it's sort of like tricking your mind, right?
Right, yeah. And so like I wanted to try CBD. And so, and this was before it was legal here. And so like we snuck into one of the shops and I had a recording device hidden, and we did like one of those hidden microphone things. It was so funny.
And fun. It's like...
Oh, total fun. Total fun.
So other than, needing to perfect your right hook throughout this process, can you tell me a little bit more about what your symptoms looked like? You mentioned tremor. What else?
Sure. So at the time, my walk deteriorated from a sort of a wonky, like slap thing to just sort of a shuffle. My handwriting had gone from normal, I could read it, to practically illegible, small, very tiny. Like after a meeting, you're like, I have no idea what I was writing. You end up, there's motor symptoms and then there's non-motor symptoms. And they call it a motor symptom disease, but it's really a full body disease. So you have apathy and depression and anxiety. Those are not just reactions to the diagnosis, but those are symptoms of Parkinson's. And then you have sleep issues. So you've got the RBD, which is the REM sleep behavior disorder. You have restless leg syndrome, and you have insomnia. And then you have frequent urination at night. So there's all the, literally, I think there's over 100 different things that you can get. Not everybody gets everything, which is so wonderful because that means it's all personalized medicine. Everything you do is to treat your symptoms. So you need to be talking to your doctors and develop those relationships. And for me, I wanted to focus on things that would help my life. So I couldn't throw a Frisbee with my son anymore because I couldn't figure out how to release it on time. And which is hard, right? I couldn't fit my right hand in my pocket of my jeans. And so when you're in a taxi and you put your wallet in the wrong side of your pants when you're standing up, and I'm trying to reach over and I'm doing some sort of crazy dance in the taxi in the back seat, or I'm running to get a bus and as I'm running, I forget I have Parkinson's and my legs don't work that way anymore. And I fall and scrape my face and the elbows and all these things happen. And you're like, every time it's another blow, it's another setback. It's another, I fell down the stairs. One time I was sitting at the kitchen table and I fell off my chair just because whatever, you lose your sense of grounding or whatever. And so you need a care team in order to help you. It starts with you at the center, and then your wife and your movement disorder specialist, and then you build out from there. I see my pharmacist more than anybody, so I'm filling up drugs all the time. So we got to be friends, and then all my therapists, so mental therapy, and I've got a physical therapist and a speech therapist and all these therapists. So and they become part of the team, and you use them when you can, and And it's the whole experience is overwhelming at times.
You mentioned this care team that you had. How much communication was there between your care team? How much did you have to spend educating each person about the other treatment you're receiving, or did they have some sort of back-end connection?
There's never a back-end connection other than you say, if you're getting tests, let's say I'm getting an MRI or whatever, I'm like, can you please send this to my family doctor and to my movement disorder specialist? And they will happily. But there's no central computer. It's me. I'm at the center. So it's a full-time job trying to get everybody connected and talking to each other and working with each other. And what you try to do is I try to get recommendations, or at least, doctors won't make recommendations to therapists. I don't know if you know this or not, but they don't like to do that because they're not allowed to give the recommendations, I guess, to certain therapists or whatever, at least here in Canada. So they can say, you should go see a physical therapist. And here are 17 of them. Good luck. Or,
And 16 of the 17 have 3-month waits.
Right. Yeah, exactly. And so it's a full-time job just to keep everybody in the loop. And if you have a full-time job on top of that, then that's kind of hard.
Well, and you also have the job of being a partner and a parent.
Yeah.
So can you share a little bit about what this experience was like in your marriage, in your co-parenting relationship, how Rebecca was impacted by this?
Yeah, let's start with Rebecca. She's great. We've been married 25 years this year.
Congrats.
Thank you. So in 2017, when I was diagnosed, like, well, like, I'm not being caring for you. I'm not your care partner. I'm just, your partner. We're partners. We have always been partners. And it was just another bump on the road. But over time, she realized I needed more help than she thought. And so for her and for me, we had to relearn how to communicate, because I was not, like, we were passing ships in the night. Like, we could not, like, I'd say something, she'd misinterpret it. She'd say something, I'd misinterpret it. I'm like, this is not working. So what we knew how to do so well as communicators was no longer part of our repertoire. So we actually started over. Okay, let's go back to base and let's figure this out together. Lots of tears, lots of moments of like, oh my God. And I even gave her an out. I said, if this is too much, you have my permission to go.
And how old is your son at this point?
Well, he's 14 now, so that would have been 7 years ago. So 7.
So pretty big move. I mean,
Yeah.
You've got a family.
Yeah.
Yeah. So this is impacting you immensely. You somehow landed with deep brain stimulation as a solution for care. What brought you to that point?
So deep brain stimulation has always been kind of in the chatter in Parkinson's community. And I'm like, brain surgery? Not for me. No, thank you. And so after a while, I was like, as the symptoms increased and intensified, and I went from beginning with 1 pill every 3 hours to now I was up to 2.5 pills every 2 hours, taking 8,350 pills a year. I thought, this is not helping my lifestyle at all. Every 2 hours, my alarm's going off, and it was miserable. And so it was in 2019, my doc said, hey, have you thought about DBS? And I said, I've thought about it and I don't want to do it. He goes, well, it's 100 people deep right now. We have 1 surgeon in the province. So let's get your name on the list. And if it comes up and you don't want to do it, that's fair. Just say no thanks and they'll move on. No harm, no foul. But if you do need it, and I think you're going to need it, then you're on the list. And so it worked out perfectly. We had a pandemic over that time, and so the list got a little longer. And so by the time my name came up, I was ready for it. And he had prepared me well. And now, after DBS, I take a half a pill of levodopa every 6 hours, which is amazing to go from 23 to 2.
And you said how many pills was that a year? You've done the math.
8,350 pills a year.
So now what's your yearly count?
My yearly count is 700.
700. Pretty impressive.
Yeah.
Huh. And your physician that you worked with is Dr. Honey, and we did an episode with him just prior to this. And episode 1 of this 3-part series is really addressing his side from the clinical perspective. And we're really excited to be able to host both you and Dr. Honey after this to discuss what building a care environment as a patient and clinician looked like. With respect to getting connected with Dr. Honey, it sounds like he was the only option. We're based in Vancouver right now, British Columbia. You said he's the only clinician in the province, right?
He was at that point. There's 2 now.
Okay, 2.
2.
So, we're getting someone.
For 15,000 people, there's 2 surgeons, yes.
Yeah. Wow. And the wait time you had?
I had 4-year wait.
4-year. Okay. Can you tell me a little bit about the progression of your disease through that time? Did things get worse? Did it get
It
better?
did get worse, yeah. And as I took more medication, there was more of the dyskinesia. There was more, which is the reaction to the carbidopa, levodopa. So it's what you see when you see Michael J. Fox. Mostly it's dyskinesia, not tremor.
Okay.
And it's sort of the jerky movements. And then just the non-motor symptoms were killing me, like slowly killing me from brain fog. And then it's this executive functioning that just, you can no longer multitask, you can no longer think through. Like it took me 5 hours once to write an email just because I couldn't keep focused. I couldn't do it. And so it was, and at the time I had a full-time job, and it was hard. It was hard to feel like you were leading anybody anywhere when you couldn't even lead yourself to write an email. It's like, it was devastatingly difficult to live life. And there were times where you got, maybe it'd just be better if I wasn't here. Like it gets to that point. When it gets to that point, as long as you're not making plans and you're just saying it, then they'll let you go through the surgery. But if you are suicidal, they won't let you go through the surgery. And there's a nice mental evaluation that they put you through to make sure that you're good to go. And so, yeah, my symptoms increased quite a bit. And I didn't know how much Parkinson's had taken over until they took me through the pre-op. Before they accepted me into the program, they had me go off my meds 100% for 14 hours and then come in. I'd never been off the meds since I started. And my right tremor had ended up taking over both sides of my body, from my right hand to all my body. It was like a full body tremor. I was shuffling and moving like at a snail's pace. It took me 5 minutes to get in and out of a car. My wife said I aged 20 years overnight. It was horrible. And I took 2 levodopa after they did the tests. And those 2 pills, 40 minutes later, and I was back to better than ever.
Wow.
It was wild.
And we'll say the powers of modern medicine.
Oh, when I used to complain about carbidopa levodopa because it was discovered in the 70s, so it's like way past its prime, and it's the only thing we've got. And yet it is a miracle drug, because without it, I wouldn't be here.
And you walk through in one of your podcast episodes, actually, this experience of going off of the medications. And one thing that I thought was interesting was that Rebecca had noted that certain symptoms were worse that you weren't necessarily aware of. And I can imagine when you're navigating such a broad spectrum of symptoms that even keeping track of the timeline is pretty difficult.
It is. And that's the important part of a care partner, too. My care partner should go to doctor appointments with the person with Parkinson's, because they do notice things. Things come up that I don't know what's happening. She noticed mood changes, all these things. And they actually tasked her to, like, if his personality shifts, you need to let us know. And they made her sign off on documents and stuff for the surgery, because the surgery can cause that to happen, where people maybe be too elated. You could get that euphoria where you're 17 again and you can do anything and you're invincible to the world. They don't want you to feel that way, but I would love to feel it.
I can imagine.
Yes.
So you shared a little bit about the experience with Rebecca. What about your experience as a parent? How did this journey impact how you were able to connect with and relate with your son?
Henry he's 14 now. So for the surgery, he was 14. And I would try to walk him through it like a little bit at a time. I was like, so Dad's going to go in and they're going to drill, and they're going to drill, Dad? I'm like, yeah. Ooh, okay, that's enough of that. So a little bit at a time. And then one day, as we got really, like, we had done our will, and like he was aware that, like, we were preparing for stuff. He goes, okay, Dad, I don't want you to die. I said, I don't want to die either, son. He goes, but if you do, could I have your iPhone? Like, sure. Well, it's going to be up to you and your mom because I won't really care. But yeah.
What I'm gathering from that is that he's adopted some of your sense of humor.
Yes. Yeah. So he's great. And they were both there in between the MRI, the day of the surgery, and the surgery. I got to be with them, and he was holding my hand and wiping blood off my face where they'd put in the what do they call it? The stereotactic frame, where they put the stereotactic frame on your head so they can bolt it to the surgical table so you don't move your head. And so, but they twist it through your skin, like with screws, and into your skull with local anesthetic.
So can you share in your own words, because, it's one thing to hear it from a clinician, but another from someone who's been through it, what exactly is deep brain stimulation?
Obviously, I couldn't see it happen. So all I can do is tell you what I felt, and what I know is they drilled 2 holes right at my hairline, 2 boreholes right here. And then they were trying to place electrodes in there. And so as they placed electrodes, they would test me, and they'd say, okay, Larry, say 4, 5, 6. And the first time I went 4, 5, 6. I thought, oh, it goes to poisons. And then they said, okay, try it again. I said 4, 5, 6. And then do it again until it was like 4, 5, 6. They're like, okay, lock it in. And that's when they put it in. And so they knew the path they wanted to take because they had MRIs. They stacked them up and they created a path. So they knew where they wanted to go, but then they had to place it just right so it wasn't going to mess up my speech, and it was going to be the right, they nailed it for me, the right positioning. And then, so the whole process, it takes a while, but I had a nurse with me the whole time. She was my nurse. So she would be there holding my hand, wiping my brows, scratching my nose because I couldn't put my hands up there. She would go get whatever I needed, or I had a playlist. She started that. And the first song was Staying Alive. I said, okay, Dr. Honey, this one's for you.
Humor never stops.
No, never stops. And well, if you can't laugh about it, right? And so they put the electrodes in, and then once both sides are done, then they knock you out and they put the battery in over your heart, which is where all the technology is. And then they run the wires just under your skin, right behind your ear. And then you can feel it right here. There's on the top of my head. It goes all the way around. I can feel it. And it's kind of wild. And then there's a recovery period of like 10 days. I was like a hibernating bear. I just slept all the time. And then when your symptoms are better and your lifestyle improves, but they haven't turned the machine on yet, that's called the honeymoon. My honeymoon lasted 10 weeks. Usually lasts about 6. So my schedule to go in December to have the device turned on. But when I went in, they're like, you're too good. I can't turn it on. So we waited till January. So my device was turned on this past January. I had weekly dial-in sessions through February. And then they said, okay, we'll see you in 6 months. And that's where we're at today.
Travel back in time with me to this honeymoon period.
Yeah.
I want to know how you felt. What was this like?
It was like I was Parkinson's free. It was amazing. Like I'd heard about the honeymoon, but I didn't know what it meant. And then now I meet people who don't have any honeymoon at all, or a very little honeymoon. I'm like, oh, I'm sorry. But I felt free.
So I've brought up your humor a bit because it comes out a lot in your podcast, and I love that. I'm curious, how much of an impact do you think your outlook and your humor and the sort of hopeful nature that you bring to the table has influenced this journey?
Well, I think attitude's a lot in life, and not just in my life, but in everybody's life. Go around being, you have choices every day, how you're going to accept things, how you're going to deal with things. And if I chose to be negative and bothersome all the time, then that's the life I'd get. But because I put positivity out in the world, I get it back. The other thing that I think really impacted this particular thing is I had full trust in the surgical team, 100%. You just have to give yourself up, because there's no more vulnerable position that you can be in than having your skull wide open to your surgeon and their team. So if you don't trust them, you're doomed.
You did have some moments where you were feeling pretty heavy-hearted, it sounds like. You were asking yourself, do I want to be alive? How did you work your way through those moments?
You have to accept them, like acknowledge them. And I do some writing, I do some poetry. I like to talk it out with my wife or my therapist. As soon as I started having those thoughts, I went straight to my therapist. I said, here's what's happening. And she goes, okay, are you making plans or are you just talking? I'm just talking. She goes, okay, if you start making plans, we need to know. And I think that there are times for everybody that has this disease where you're just like, I don't know if it's worth it. And it's worth it. It's worth it. If you get the right treatment at the right time, at the right place. And I'm not saying DBS is the answer for everybody, but it certainly worked for me. And it was the right thing at the right time for me, because I don't know that I could have gone much longer without it.
I'm so glad you found it when you did.
Me too. Me too.
So I'm coming from the context of being from the United States, and I understand our insurance system pretty well. What is medical care like in British Columbia? Did you use insurance for this procedure or anything like that?
No, unfortunately, I didn't. Well, I guess fortunately. I've never seen a bill for my Parkinson's treatments. It's all part of the taxes we pay, and everybody has right to health care, and
Including deep brain stimulation.
including deep brain stimulation.
Wow.
We had to lobby for it, I guess 7 years back, to have it part of the insurance plan. But yeah, it's remarkable. I'm originally from the States too, so I understand the difference between the two. And I used to make fun of the socialist medicine of Canada. And now I'm like, thank God for it, because I don't know what I'd do without it.
Hmm.
Yeah.
Wow.
You have to wait a little longer sometimes, but you know what? You got to wait a little longer to get in to see the best doctors in the United States as well.
Too true. And the wait to pay off the bills is a lot less long.
Yes.
Throughout the process of navigating deep brain stimulation, I'm curious if you can share whether or not there was anything that came up that you didn't expect, that you would have liked to have known about sooner.
It's a great question. I would have liked to understand more about the stereotactic frame that they screwed into my head. They said, oh, it's just a bee sting. I was like, okay, let's call it a bee sting. It was not just a bee sting, but it hurt. That was probably one of the things that hurt the most. But they got to do it. So I guess once you're there, you're not going to turn back just because of that. And there was nothing stereo or tactic about it.
Can you describe this?
It's a combination between a horror movie mask and a medieval torture chamber. It's like this metal device that goes over your head really snug, and it's got locks, or I guess screws that screw into the operating table, so your head can't move, so you can sneeze, and you're not gonna jerk your head while they're playing with your brain. But in order to do that, they have to screw it into your skull. And so that was weird and something I wasn't expecting. The other thing is, I've been having problems. The only downfall so far for me about the surgery, and it's everything else has been perfect, but I've been having problems with spatial relations. So I'm bumping into things. I'm banging into walls, and sometimes it's like I'm propelled. And I was talking to doctors about that. Like, yeah, that happens. He goes, anytime you screw with the brain, something's gonna, they've gone in there and they've made some holes and stuff, and so you have to create new neural pathways in order for that to course correct. So over the course of time, that'll get better.
Okay.
I'm like, oh, that makes total sense to me. Like, yeah, of course, you've drilled into my brain and now you're inserting things and something's disrupted. I suppose it could be a lot worse than that. So now I'm the bump into things guy.
So when you think about sitting in that chair, or were you laying when this device is put on you?
I was laying. I was kind of laying, but my back was up. So
Okay. So while you're there, do you remember any of what you were thinking? What was going through your mind?
yeah, I'm like, what the heck did I get myself into? And when I was talking to my wife in between, but after the MRI and before the surgery, I just said, I don't know, honey. I think I'm going to get a choice at some point in the middle of the surgery to stay or to go. And I don't know what I'd take. And she goes, well, whatever you decide. And for me, that response was the reason to stay.
Very generous.
Yeah,
Sounds like you have an amazing partner.
I do.
On your podcast, you interview somebody who actually had to have their device removed. That can happen. It's great to have that awareness. I love that you featured that on your show. And so I can imagine many people that are considering this procedure have some nerves coming up. They don't know what's going to happen. They don't know if the device is going to work. For you, it has. For others, it hasn't. There is a lot of wiggle room there,
Sure.
right? So what would you recommend? What advice would you provide to folks that are trying to make that decision?
Well, I mean, do your homework, read up on it. And if your body doesn't accept it, because, your body's not meant to accept like metals and stuff into your body. And if it gets infected, they may have to remove it. That's just part of it. One of the cool things, though, is I was debating whether or not I should get it, because what if there's new technology that I want in 2 years? Like, you know how technology cycles are. Like, you get the new phone and then you're like, but I want that phone now. And what I was told by some of my doctors is, well, the great thing is you don't ever have to have the DBS removed. We'll just layer on the new technology over top of it. And I'm like, well, that's so super cool.
Wow.
So that put my mind at ease for that. Anytime you're going to go in for a surgery, whether it's a tooth extraction or a brain surgery, you should make sure that you know what the risks are and know, who your surgical team is. And Dr. Honey's done over 1,000 of these and hasn't lost a patient yet. And I'm like, well, let's not start now, dude.
Staying alive.
Staying alive.
That's not going to be stuck in my head the rest of this day. So with that, we're about to interview both you and Dr. Honey at the same time. Really looking forward to that opportunity. For this episode, do you have any closing remarks, or is there anything that we missed that you'd like to cover?
Well, I just want to tell people there's hope for you. Whether it's DBS or something else, there's hope. So you have to do the research. You have to do the homework. It's not going to just land in your lap. You have to be an advocate for you. And if you don't get along with your surgeon, or if you don't get along with your movement disorder specialist, fire them and get one that you do get along with, because you've got this for the rest of your life. And so it's like trying to find a partner for marriage. Like, this is a long-term commitment. And so I highly recommend that people shop around and people make sure they're comfortable with that. And I really want them to advocate for themselves. And there's a whole generation of people that are older than I am that aren't used to that. And my mom's generation. And they just, well, I don't know, the doctor said I should take this, so I should take it. And it's like, you have a choice, especially with Parkinson's, because nobody knows anything about how to cure it or how to make it better, other than we're going to cover this symptom because this is giving you problems. So make out a list of the biggest problems you've got, what's causing you the biggest issues in your life today, in your lifestyle, and put those at the top of the list. Give them to your MDS first thing when you walk in the door, or email them ahead of time so he can address, or she can address those right away, because that's what they're doing. They're just playing whack-a-mole with your symptoms.
Wow. Well, this has been really informative. And I would like to extend that for folks who are starting to do some research on this, your podcast, When Life Gives You Parkinson's, is a really great place to start. It walks people through your journey from start to finish, gives you insights into the procedure. We actually get to meet Dr. Honey there as well.
Mm-hmm.
Is that
And
correct?
Nurse Nancy.
And Nurse Nancy. And with that, thank you so much for being here.
Thank you.